Hello, everyone. I'm Kevin Kunzman, managing editor of Contagion, joined for a somewhat rare second half coverage, I guess you could say, of a video conference interview regarding some new and very pertinent data as to our evolving understanding of COVID-19. I'm joined today by Dr. Adrienne Randolph. Dr. Randolph is the clinical lead on the Overcoming COVID-19 study and an author on a recently published article regarding multiple inflammatory syndrome in children in the U.S., published in NEJM earlier this week. And we actually talked with Dr. Randolph's colleague from the CDC, Dr. Manish Patel, today about these findings. And we're going to expand our understanding a little bit about how syndromes like the one being observed right now during the pandemic affects children and what we need to do to appropriately respond. But before we get into that, Dr. Randolph, how are you doing?
Oh, I'm doing pretty well. Thank you for that kind introduction. And I'm glad that you spoke with my colleague Manish Patel from the CDC as well, because he has a different perspective than I'm a clinician, so our perspectives are a little bit different.
Yeah. I mean, the pleasure's all mine, Dr. Randolph. It worked out so excellently that I got to talk with him and sort of lay a foundation of understanding as to how exactly it's presenting right now, is sort of understand the epidemiology a little bit better of MIS-C.
So this is, that's an important question. So MIS-C first was reported in England with a small number of cases that look like Kawasaki Disease. And then it was reported in Europe with the same, a lot of people were making comparison to Kawasaki-like disease, because the cases that they're reporting had rashes and that's sort of like the in their mouth and on their eyes and skin symptoms. And so we just started doing a surveillance study for this. We were already doing a big study on COVID with the CDC across a lot of pediatric sites, and started collecting data and very intensively asked all our clinicians to look for cases and report them to us. So we ended up with very quickly 213 cases across 53 centers in 26 states. And so a month ago, we submitted the report to New England Journal. It turned out that New York State was also doing surveillance, and they submitted a report. And so our final report, so we didn't have overlap, had 186 cases. And it was very similar to what is reported elsewhere in the world. The median, which means the 50th percentile of the age group, was 8 years old. That's exactly what other people were seeing. A little bit different from what other people were reporting is that ours, about 60% of our cases didn't have Kawasaki-like features, or didn't meet criteria. You know, Kawasaki-like features are broad, but they didn't have enough of them to meet criteria for Kawasaki-like disease. So, but 80% of them had cardiac involvement, and were mostly very severe in the ICU, most of them. It was a lot, you know, the other most common symptoms was that they had abdominal pain, diarrhea, vomiting, sort of gastrointestinal symptoms. And so the heart and the gastrointestinal symptom was very common in our cases. And we had, in our case series, we had clinicians, mostly intensive care unit clinicians, identify the cases with infectious disease clinicians for reporting and extract the data for us, so that we knew that this is what they were seeing and that the data were really accurate.
Wow. Yeah. And it just seems to be such a huge breakthrough, which something, and I mentioned this to Dr. Patel earlier, sort of read as, you know, journalistically speaking, it was coming up in blips. It was sort of this ominous research that was sort of coming out. And again, the first time we encountered it in terms of clinical discussion was in Italy. In regional bursts, it seemed.
Right.
And, the immediate likening was to Kawasaki disease, and
right.
what this could be doing to children, and it's tied to SARS-CoV-2. And Doc, you may be better than almost anyone to explain a little bit about exactly what does that mean for children? What does that connection to Kawasaki disease mean in these infected children?
Well, you know, these patients have Kawasaki-like features, but it's probably different than Kawasaki disease itself. It's unclear exactly what this is. It's clearly linked to SARS-CoV-2 because the great majority of these kids either were PCR positive, which means the respiratory test, or they were antibody positive from their blood for SARS-CoV-2. And SARS-CoV-2 just hasn't been around that long. And to get antibodies takes about, you know, a few weeks at least. So we know that it was a recent infection. So, so basically, you know, there's a clear link here to SARS-CoV-2 in these patients. The, you know, association with Kawasaki's disease is because there's some overlapping features. And one of the things that we worry about with Kawasaki disease is the coronary arteries. So Kawasaki's disease is a vasculitis, blood vessel inflammation. And so we look in these patients with echocardiogram, the ones especially who have cardiac dysfunction or their heart's not working completely normally. And we look for these aneurysms on the echocardiogram. And we found about 8% of these children had the coronary artery dilations that were big enough to be considered an aneurysm. So that's very important because Kawasaki disease is the most common cause of acquired heart disease now. These patients who haven't and developed the coronary artery aneurysms need long-term follow-up. We don't know what the long-term outcomes of these children with the aneurysms are, or other cardiac problems that they suffered, which some of it was their electrical activity in the heart was abnormal, or the function, the muscle of the heart wasn't squeezing normally. And these were mostly healthy children. So over 70% of these kids had absolutely nothing in their medical history. So no diagnoses, nothing. So that's very different than, you know, acute COVID-19 infection that causes lung disease in children is very rare. And the majority of those kids who get significant lung disease requiring oxygen and other support have a lot of underlying conditions. So healthy children in general don't get so sick from a respiratory standpoint. It's very rare from acute COVID-19 virus. But this group of kids that got the MIS-C, the great majority of them were previously healthy children.